Hello, I am Arabella Hayter, and I work with WHO's headquarters on WASH in healthcare facilities. Welcome to Module 1, Setting the Scene, National Actions and Health Engagement to Support Effective WASH Fit Implementation. By the end of this module, you will be able to describe how WASH Fit can support system strengthening and be integrated into key health programs. You will gain a comprehensive understanding of WASH Fit's purpose and scope, including its focus on incremental improvements and the 5-step cycle. We will also discuss which national actions are key to the success of WASH Fit and how they are tracked by WHO and UNICEF. We will also look at what resources are available to support you. Now, more than ever, safer and more sustainable water, sanitation, hygiene, and waste services are needed in healthcare facilities. An estimated 8 million individuals die annually from poor quality care, and up to 1 million mothers and babies die from unhygienic births. Many of these deaths could be prevented through better WASH services and improved infection prevention and control, saving lives and reducing costs. There is also an urgent need for cost-effective, sustainable responses to humanitarian crises, which affected 363 million people in 2023 alone. The latest global frameworks and monitoring plans for primary healthcare, infection prevention and control, and child and maternal health all specifically articulate indicators and actions for improving water, sanitation, hygiene, and waste services in order to achieve wider health goals. This includes combating antimicrobial resistance, otherwise known as AMR. WASH and waste services in healthcare facilities are one of the 8 core components of IPC and are included in the 2024 IPC Global Action Plan. Strengthening primary healthcare, or PHC, as a means to achieve universal health coverage is the major focus of the health sector and health sector strengthening. Physical infrastructure, such as WASH and energy, is one of 14 critical and interdependent levers identified to achieve PHC. WASH can be used to accelerate progress in strengthening PHC-oriented systems. In addition, improvements in climate-resilient WASH and energy services can also be used as drivers and indicators of progress to achieve national PHC goals. The WHO and UNICEF Joint Monitoring Programme on Water Supply and Sanitation, or JMP, has the official mandate under Sustainable Development Goal 6 on safe water and sanitation to monitor WASH in households, schools, and healthcare facilities. The JMP issues reports or data updates every other year. The data from 2021 indicate that large gaps in service remain. 1 in 4 healthcare facilities serving 1.7 billion people lack basic water. This means that there is no improved source of water on site, not to mention any assurance of safe or sufficient water. Please note, these figures will be updated in 2024. You can check www.washdata.org to look for the latest global, regional, and national data. For the first time, there are now global estimates of electricity services in healthcare facilities, which indicate similar gaps. 1 billion people are served by facilities without reliable energy. Electricity is critical for proper functioning of WASH infrastructure, for example, water pumping, heating, and waste management technologies. Efforts are increasingly being made to consider and include electricity when speaking of safe and resilient infrastructure services in healthcare facilities. So now let's move our attention to WASH Fit. WASH Fit is a flexible framework for use in a range of healthcare settings. It is based on a 5-step cycle undertaken at the facility, as shown here. This course will take you through each of these steps in turn. The core function of WASH Fit is to foster the development, monitoring, and implementation of improvement plans, prioritizing climate resilient, equitable, and inclusive improvements. Flexible in nature, it is adaptable to a range of contexts, where it can be used either independently or integrated into existing quality improvement programs. Importantly, it is a means to track and measure progress and to engage and hold leaders to account. WashFit addresses infrastructure, behaviors, and ongoing operation and maintenance. This ensures a comprehensive approach to enhancing WASH practices and services in healthcare settings. So, what is the purpose and the expected outcomes of WashFit? Well, WashFit can help to improve a range of important health and other outcomes. It helps improve environmental sustainability and climate resilience through climate-focused indicators, improve infection prevention and control, and reduce antimicrobial resistance. It can strengthen outbreak response and resilience, enhance quality of care by preserving dignity, especially for pregnancy, delivery, postpartum, and newborn care. It can improve staff and patient respect and develop a supportive environment. By fostering trust and improving access to healthcare services, WashFit also enhances overall health system responsiveness, benefiting communities and populations. It can also be used to improve gender equality, disability, and social inclusion through the planning, design, and management of WASH services, which promote accessibility, safety, privacy, social appropriateness, and acceptability. This is all achieved by taking a multi-sectoral approach, bringing together stakeholders from a range of backgrounds, including legislators, policymakers, district health officers, hospital administrators, engineers, and environmental specialists. Engaging healthcare service users, civil society, and community members acknowledges their rights and contributions to the process. This photo is from a healthcare facility in Bhutan. Take a moment to consider the main areas for improvement in order to maintain a safe and hygienic environment, either in this facility or a typical facility in your context. Pause the video and take 2 minutes to write down the areas you think should be covered by WashFit and where you see any specific improvement needs in this photo. WashFit is based on 7 domains, which are crucial for a healthcare facility's functionality and safety. These domains are water, sanitation, waste management, hand hygiene, environmental cleaning, energy and the environment, and finally, management and workforce. Additionally, there are 2 cross-cutting themes, climate and GEDC, otherwise known as gender equality, disability, and social inclusion, with indicators integrated across the 7 domains. Specific indicators within each domain, aligned with WHO global standards, provide a metric for assessment and improvement. We will look at how the assessment is structured in Module 3. The standards on which the assessment is based include WHO's Essential Environmental Health Standards, Drinking Water and Sanitation Guidelines, IPC Standards, and Climate Guidance. There are also other courses on Open WHO which allow you to deepen your understanding of some of these areas. You will find links to these guidelines and training materials in the resources list. In 2019, all 194 WHO member states committed through a World Health Assembly resolution to meet the target of universal access to water, sanitation, waste management, and hygiene services in healthcare facilities by 2030. In the same year, WHO and UNICEF outlined a set of national actions, known as the 8 Practical Steps, to guide countries in improving WASH in healthcare facilities to advance quality of care, to form the basis and framework for national action and commitments made in the 2019 resolution. These practical steps are now also articulated in a United Nations General Assembly resolution, which member states unanimously approved in December 2023. The 8 steps are based on what works to drive and sustain improvements. A range of resources exist to support their implementation. Please refer to the resources section at the end of the module. WashFit contributes primarily to step 4, improve and maintain infrastructure. However, other steps are also related to WashFit implementation. For example, WashFit provides a means to achieve and monitor standards, step 3, and to monitor and review national data, step 5. To understand how countries have been improving wash and healthcare facilities, that is, to see where countries are making most progress and where the biggest gaps remain, an analysis of implementation of the practical steps was undertaken. A country tracker with an online data collection portal was established by WHO and UNICEF. The tracker helps guide countries on their improvement journey to deliver higher quality care by showing the extent of national progress over time and where further efforts are needed. The progress rating for each step, on a scale of 1 to 4, provides evidence to governments and partners about where investments are needed and where they are most likely to have impact. You are encouraged to visit the tracker and see where your country is in implementing the practical steps. You can also download related resources. If no data are available for your country, consider why this may be and think how your country can work to address these gaps. A variety of resources are available to support you when using WashFit. At the forefront is the second edition of the WashFit Practical Guide, which offers a comprehensive overview of the tool. We recommend that you take some time to read this document as part of your learning. The guide includes a set of tools for each of the 5 WashFit steps, which are available in PDF, Word, and Excel format. These tools include sanitary assessment forms and monitoring templates. The assessment tool is also available on Kobo Toolbox. For those planning to deliver training on WashFit, there is also a comprehensive manual for trainers, which includes slides and speaker notes. Technical fact sheets cover gender equality, disability and social inclusion, climate resilience, healthcare waste management, hand hygiene, and safe plumbing. Some key points to remember from this module. WashFit is a comprehensive framework for improving quality of care by addressing water, sanitation, hygiene, waste management, cleaning, energy, and facility management. By improving wash services, it seeks to improve staff morale, patient safety, and environmental sustainability. WashFit is an adaptable framework which can be used in a wide range of healthcare settings, from rural clinics to urban hospitals. With over 75 countries now implementing WashFit, there are a variety of case studies, examples, and best practices to draw upon. To support implementation, a comprehensive suite of resources is available, including guides, tools, and an online portal. Thank you for completing this module. Now that we have introduced WashFit, we will dive into the specifics and walk through each of the steps one by one.